Well, Arizona, one of several states where cases are rising. So how do we compare overall? And could state leaders be doing more? Tonight, ABC 15's John Genovese is breaking down those numbers.
Across the country and with flu season right around the corner, many experts say we're now entering a third wave of coronavirus cases that could stretch into the new year. Arizona seeing an increase, but our state's still faring much better than just a few months ago. Even so, emergency room doctors say their concern has never let up.
It's very high, and I'm not trying to be an alarmist at all.
Over the past few weeks, Arizona's percent of positive test rate growing to above 5%. At the worst points in June and July, the state was averaging more than 3,000 new cases a day. On October 1st, the average was 480 a day, and as of this morning, it's risen to nearly 800.
We are starting to see at least a steady pickup in that average increase. In fact, only about a week ago, it was 500.
ABC 15 data analyst Garrett Archer says despite the case count bubbling up, severe illness and death from the virus remains relatively flat.
We're looking at right now case increases coming from demographics that are less likely to have to be hospitalized and take up those resources.
But no one knows how bad things will get or where this hill will peak. Governor Doug Ducey committing last month in terms of restrictions and closures, we're not going backwards.
Arizona's open. We are not going to be, due to a gradual rise in cases, be making any dramatic changes. We should expect a rise in cases.
There's some simple things that we could do right now that will make a real difference and prevent us from having to do something more difficult later.
Arizona Public Health Association Executive Director and former State Health Services Director Will Humble believes the governor should still enact a statewide face covering mandate and increase enforcement when it comes to businesses like bars and restaurants not following the rules.
There's a whole bunch of CARES Act money just sitting to be used for intervention purposes, and that could be used for the state to get contracts out to the county health departments, so there would be local folks that could follow up on these complaint investigations.
He says in terms of what's allowed and what's not, it's all about weighing the potential benefit and risk. What's okay now might not be the case if mitigation measures aren't proactively taken, and another hotspot here erupts. John Genovese, ABC 15, Arizona.